What happened to Susan? We didn't make it.
Sorry.
Oh,
It's okay.
hello,
I thought
William.
it was the mute button. It was the see you later button.
Wow, intense. I was like, we all left together. We should all be here. Hi, Christina. We're happy to have you here. So, if you're just joining us, we're just getting here. Hi, Deirdre. Good to see you. It is 7 p.m. Thursday night on the East Coast. It is February 4th. This is the OCD Town Hall on anger and rage. It is a great topic, Aaron. Thank you so much. So, as always, before we get started, we have an awesome panel for you tonight. We'd like you to say hi, let us know you're here, say hello, tell us where you're from, what the temperature is out. So if you say 73 or 74, we can have immediate disdain for you. We'll always give it a couple of minutes. So yeah, say hello. Let us know you're here. Hey, wait, Kyle. Apologies for those of you watching that probably don't know what we were talking about. But Kyle, you're already a king. Why do you want another title?
I just feel like being knighted is so cool. Like, I feel like it trumps being a king just in name alone.
I'm always afraid they're accidentally going to cut off my ear when they do the shoulder taps with the sword.
Because that's happened to you so often.
Ethan,
I've been knighted 3 times. Yeah.
Let's see. Sir, Ethan?
What's that?
Does that make you Sir, Ethan?
It does. It does. Sir, yes, Sir X3 Ethan. Hi, Christina. Hi, Cece. Caroline says, Kyle. And she says it just like that. Kyle. Hey, guys. Audrey from Maine is here. Tanya from New Jersey is here. William watching on YouTube from Memphis, Tennessee, and it's 54. 54 sounds lovely. Eric is here. Eric is like the king of trivia. Haven't seen you in a while, Eric. Good to see you. Crushed trivia night the week of the conference, last conference. Merrill, Pennsylvania. Love Lana. Hey, love. Hey, love. Hey, Lana. Aaron in Fort Worth. 60 degrees. Lovely Sina. I hope I got that correct. Heather in Virginia. So many nice people. All right. Well, we are just over 2 minutes. So thank you so much for saying hello. Got a great group of people here. So let's just get started. We have a good conversation. So my name is Ethan Smith. I'm a national advocate for the International OCD Foundation, which means I have OCD, and I'm not going to stop talking about it. So that's that. So some quick housekeeping. This town hall is intended to serve as educational content and is not intended to replace therapy. For treatment-related questions, please be sure to work with your local provider or contact a local clinician. The International OCD Foundation is not a crisis hotline and should not be used if you are in distress or feel unsafe. If you're in a crisis or you're ever feeling suicidal or unsafe, please go to your local emergency room, call 911, or call the suicide prevention hotline at 800-273-8255. As always, we want to be respectful and kind of others. Yes, this exists on the internet, on social media, and it will be there for other people to see. So please, please, please be respectful and kind to others. We try to create as safe a space as possible to be able to support each other and one another. But this is also online, so keep that in mind. But we'd like to have as open and candid a conversation as possible. Oh, I missed last Thursday trivia, Deirdre. So I guess Eric was back. Okay. I played last week trivia first time. So yeah, I guess Eric won. All right, cool. All right, let's get started. I'm a little distracted today, so it's going to be a long 90 minutes. So hopefully they'll stick with me. So let me introduce our awesome panel today. First to my left, right, I never know because it's all reversed. But we have Dr. Sony Khemlani. She's the clinical director of Biobehavioral Institute in Great Neck, New York, where she specializes in the treatment of OCD and related disorders. She's on the scientific and clinical advisory board of the IOCDF and the vice president of OCD New York. Dr. Khemlani has co-authored 2 self-help books and numerous research papers in the field. Hi, Dr. Khemlani. How are you?
Hi, Ethan. Thanks for having me on tonight.
It's always a pleasure to have you on, and we're really excited. So thank you for being here. Just below me, we have the ever-amazing Susan Boaz. She's a mom and advocate for everyone suffering from OCD and their families and friends with a special interest in pediatric and maternal OCD and the impact on families. She also focused on the autoimmune and inflammatory component of OCD and is the current ED of the Pandas Physician Network. That would be executive director. I was like, did they call you Ed there? It's just in my head.
Just like straight up, hey, Ed.
Hey, Ed. What's up, Ed? Susan loves working with the youngest members of her community and their parents and is especially excited the IOCDF is launching additional programming for kids and teens, like our online OCD Camp for Kids, which I think just happened and was amazing. She is currently the president of the IOCDF board of directors. In her spare time, she is also an entrepreneur managing small businesses. Hi, Susan.
Hey there. Glad to be here tonight. Thanks for having me.
We're happy to have you. Always good to have Susan Smile around and about. Last but surely not least, we have Sir Kyle King. We're putting it out in the universe that he will be knighted. Kyle's a first-year student at Yale University studying neuroscience and is a research assistant at the Yale OCD Research Clinic. Since recovering from OCD in 8th grade, he has had a passion for advocacy and empowering others to fight their OCD, participating and helping organize many IOCDF events. Aside from his work with the IOCDF, Kyle enjoys singing, playing guitar, and tutoring kids around New Haven. He will branch out to other cities as well. Call him. We'll pass out his email later. Kyle, thanks for being here.
Thanks for having me.
I've known Kyle since he was 13, and he's a super cool kid. I guess he's an adult now. Whatever. It's weird. I'm old. Let's move forward. So tonight's conversation is on anger and rage, which is such a necessary topic to discuss. It's not talked about often, but it really permeates in a variety of areas within the OCD and related disorders community and subtypes and ages and all that. So I'd like to start off with, and as always, please upload your questions to the comment thread. We will definitely open it up to Q&A probably in the next 30 to 45 minutes, and also work in your comments when applicable. In the meantime, we're just gonna have a conversation, but if you have any questions for anybody, don't hesitate to ask. So Dr. Khemlani, what are we, just as a broad question, what are we talking about when we're talking about anger and rage within the OCD community and how it associates?
I think, anger and rage is such a common part of OCD, but when we talk about OCD, it's sort of one of the emotions that we don't pay enough attention to. We've talked about anxiety. We talk about, depression. We've talked about disgust as an emotion, shame, but anger is something we find, and we find it all the way from children, to adults. And I think it can be triggered and manifested in so many different ways. Some people struggle. If you think about OCD, just from the definition itself, they're intrusive, repetitive, like scary, disturbing images. If you had those in your head all the time, all day long, at some point you're going to get angry and frustrated at these thoughts because you try everything possible to stop them and you can't. So it's very understandable to struggle with that. A lot of people feel very alone in their OCD, and they don't feel understood by either their family or they go to work every day and have to kind of put on a face. So there's a lot of frustration that comes along with not feeling understood or heard. And that can certainly lead to anger as well. I think for children, I think adults as well, a lot of times when the compulsions are interrupted or in some way a parent tries to intervene and stop the compulsion, you can see a lot of temper, outbursts and aggression. And typically these are kids who are not angry by nature, and they're just wonderful, great, in fact, very cooperative children. But when you get in the way of the compulsions, you just see a lot of rage. So it can really manifest in so many different ways.
Before I move on to Susan, because that's a great transition, we say anger and rage. The difference may seem obvious, but is there a clinical definition of the differences between anger and rage, just to further tease it out?
I think it's a matter of degree, right? It's on a continuum of anger, and then rage is kind of that extreme end of, I think a lot of people describe a lot of physiological experiences with anger and rage, right? You feel sweaty, your heart races. In some ways, it's very similar to what you would experience during panic. It's this hyper arousal of physiological symptoms that come along with it.
That makes sense. So Susan, as a parent, what was your experience? And she talked about, Dr. Khemlani spoke about interrupting compulsions, and especially with a child. What has your experience been in regards to OCD and accompanying anger and rage?
Yeah, I've always thought of it as, for my daughter and for a lot of the kids I've seen, it does seem that the OCD thoughts cause a panic. And in panic, you get fight, flight, or freeze, right? So sometimes we get freeze where we get kids that are like literally unable to move. Sometimes we get kids who are running away. Sometimes we get the same kid doing the same thing. And sometimes we get fight. And with that fight, we often call that anger or rage. And, I often say if somebody took you to the edge of an airplane and tried to push you out, you would do absolutely everything to ensure you were not being pushed out of that plane. And you would look like you were in a rage too if someone knew that the ground was only 2 inches away and couldn't understand why you were having this giant fit to not get off the plane. But for someone with OCD, it really does feel like when their compulsions are interrupted or in their midst of an obsession, like you're pushing them out in midair and it's life-threatening. So for us, we don't see anything life-threatening, but it is for that child. And so that's kind of how I would usually try to describe it to people. It can be very complicated because you may not know what's happening in that child's mind at that moment that you're interrupting. Let's say someone has to think, I love my mom 20 times after, their brother eats breakfast. And so they're on time 18 and they've been trying to do it 3 different times to get it right so that they can get up and get ready for school. And you interrupt them on time 18 and they've got to start over. You can see where that might cause a lot of frustration, anger, and rage. And then you're going to see that, but you will have no idea what was going on inside that child's head at that particular time. So all kinds of complexities, I think, in anger and rage. I like to say that I think no child is angry because they want to be. So if their anger is over the top or if they're raging, there's something wrong, there's something going on. And it's a good time to kind of pause and start to figure out what that is. I consider it to be a clue that there's something not right with that child.
Kyle, you're nodding. Can you relate?
Yeah. I'm a pretty passive person in general, but when my OCD flares up, I have a lot of anger. And I can think of like 2 circumstances, and when it pops up and it like upsets me as a person that I kind of have that reaction. But it happens a lot, and it's the fault of the disorder, and it's one of the many reasons why I don't like OCD that much. So like the first kind is when my parents, I had contamination OCD for anyone who hasn't kind of heard me talk about my OCD. And I got to a point where I was scared of touching practically anything in my house. And my parents, we had a great therapist out in South Florida who told them to not accommodate, which is what 100% you're supposed to do. But when I was first starting out treatment, I couldn't separate me from my OCD. So my parents would either not accommodate or they try to stop me from compulsing in the middle of my compulsion. And when you stop your kid, or what I felt was, I felt this rush of anxiety. And because I couldn't separate myself from my OCD, I thought my parents were just attacking me. I thought they were just stopping me from trying to feel better. And I thought they were just forcing this rush of anxiety onto me. And I would get so mad at them. And I've never gotten mad at them before because my OCD would get so mad. And I thought that was just me flaring up. So then I started to act out on what my OCD was telling me to act out on. That was the more extreme cases when my OCD was really, really bad. But even today, when I'm still kind of in recovery, if someone touches something that, my OCD kind of maybe has like a faint rule over, like I'll get mad at them. And I don't like it because it puts strain on a lot of my relationships. And OCD can cloud my judgment when I try to approach other people because I just get mad over something that they did and it's nothing to do with them. And it's not that I'm trying to be mean. It's just that I can't see past my OCD in particular moments. And it does put a lot of strain on my relationships and put a lot of strain on me and my parents' relationships when I was in the thick of it.
That makes sense. And what's interesting in reading some of your comments, and please, if you're commenting early, stick with us because we will get to your questions. It's interesting because right now we're talking about, with Susan, what happens when your child expresses anger or rage when in the throes of OCD or struggling, and Kyle speaking as well. But Taylor left a comment mentioning that, I'll just read it because it just pertains to what we're talking about right now. I'm a single parent who's working from home and homeschooling my 3 children. I'm having trouble tonight. My son wasn't listening on purpose, so I got rage, anger, and it triggered intrusive thoughts. It's exhausting and terrible. So, you have the alternative, which is, something can trigger the OCD. The OCD makes you angry and rage and less patient. And, you're projecting that onto your kid, which I know in turn, probably creates a lot of guilt because then you feel guilty that you're yelling at your kid and so forth and so on. So I think there's so many perspectives and ways in which anger and rage can sort of infiltrate a relationship between you and your OCD, and then you and your OCD and either your parents or significant others, the way you relate to other people. Do you have thoughts, Sony?
I was thinking I always try to describe to parents what it what their child may be going through. And I think compulsions, especially if they're overt behavioral compulsions, those are what is observable to the rest of us. And they may not make sense because it's like, just stop. You washed your hands 10, 20 times, they're clean. What I try to describe to parents is that there's a whole world up here of obsessions, and those are the ones that are silent and they're not observable to us. And until you figure out what's going on in the child's head, then you can really understand where that anger, anxiety, that panic, fight or flight is coming from. So to just ask what's going on in your head, what are the thoughts? Go ahead.
Sorry, no, go ahead. I interrupted you.
No, I was saying just to find out what's so disturbing the child, rather than just look at the behavior, but take one step deeper into the thoughts themselves.
Susan, first of all, how did it make you feel when your daughter, I'm assuming she had some anger and rage?
Yeah, definitely.
So when she was struggling and maybe you were less educated, how did it make you feel? And then once you better understood, how did you respond differently?
I think it's a real balance as a parent because, I just have so much empathy for parents having gone through it and also just where people are now, because there's so much judgment from other people when your child's having a rage, for example, and that may be within the family or it may be out in public. If a child's throwing a temper tantrum, there are very clear things that you're supposed to do to end that right away. But I think similar to a temper tantrum, with a 3-year-old, that's really kind of the same thing that you're seeing, even when someone is a little bit older. And the only thing to do for a temper tantrum really is to kind of wait it out. So, at first there's a lot of, it triggers anger or anxiety in you as a parent. And so, again, I think anytime, I was joking about this the other day in front of her, so I think this is okay to say, anytime I feel frustrated or like I'm not liking her as much, I generally know there's something going on with OCD that we need to deal with. And even when she was little, kind of holding that truth of I'm feeling angry and frustrated, there's probably something happening. Once we really kind of got educated about it, then there's still certain times when, if she was in the midst of a really bad moment, I can remember a time we were trying, oh my gosh, I can remember so many times. There was a time we were trying to go to soccer and her socks did not feel right. And so she couldn't get them on and there was no way to go to soccer without getting her socks and shoes on. And there was a lot of her anger was that she wanted to go to soccer, but she couldn't go to soccer. So it was like she was angry at herself and the socks and the OCD and like everything. And so, it was coming out as I'm not going to soccer, I hate soccer, like all sorts of things. And there was nothing to do but say, we're going to wait this out. We'll be able to do it. I know you'll be able to do this. And then she would, scream, I'm going to be late. There's no point anyway, so there's all sorts of things that can kind of be piled on, but really none of those have anything to do with why she's so angry. She's angry because she can't do something that she wants to do. For myself, I would say a lot of deep breathing, A lot of times if she really was truly in a rage, it was sitting down and just saying, I'm going to stay here with you, or I'm going to give you a 5-minute break and I'll be back in 5 minutes and then I'll stay with you for a while, and just really breathing and waiting through it. I think the other thing I really like to talk about is, a lot of times we're like, oh, don't get angry at your child who has OCD. And there really is a lot to that. There's a lot of complexity in that very simple statement of, your child has OCD, they're not well treated yet, these things happen. And I do agree with that, but we tried in our family to understand that sometimes I would get angry, but I was angry at the OCD, not at her. And also that we did have boundaries. So one of our boundaries that was very, very firm, where a consequence could happen, even if it was OCD, was not hitting anyone in the family, animal, child, or adult. So, when you're really, really angry, it's easy to lash out. But our philosophy was that she was going to need to learn as an adult as well, that you can't lash out, and as a teen, and that was important to start early in the process. So we did have a couple of key things where we did have boundaries. And while we didn't have a consequence during the rage, we did have consequences afterwards. We try to do those with love, where we would say, look, we know that was OCD, blah, 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 and I'm sorry, but your responsibility is to ensure that does not result in anybody getting hurt. because we would never want that to happen to you.
I was just here awkwardly. Thank you, Susan. I appreciate that. No, I appreciate that. Thanks for the pass back. There's so many great questions here, and so many, there really are, and they touch on a number of subjects from what we're talking about to other things as well. So I want to make sure that everybody knows that we're going to try and stay on topic, but at the same time, we're definitely going to try to get to all your questions, whether they're OCD specific or pertaining to anger and rage. I just want to talk about anger and rage a little bit more. So Kyle, because I think this will help. A lot of people are talking about, how do I deal with it when I'm in the midst of an anger or raging out or whatever. What were some tools as you started to get better that you found were helpful in managing your own anger and rage, whether it was because somebody was interrupting a compulsion or because you were just angry at yourself for OCD or compulsing or just lack of self-compassion, which we'll probably get into that, but curious what tools worked for you.
Let's see. There are a couple things that I used. I think first, before I was in a rage or before I was angry about anything, I would make sure that I was well aware of what I could do to make me feel better. So I would make sure that I knew, I had these books that I could read if I was angry, or I would have a playlist ready if I got angry, just so that I wouldn't be in such a rage that I couldn't really find a way to soothe myself. I would say probably listening to music was the best thing I did for myself, and exercising. If I was mad, I would go for a run. I would just stop talking to my parents, because I knew if I continued talking to them, I'd get more mad, and then I'd say more things I didn't mean. So I would just say, I'm going to go for a run. I'd put in headphones and I'd run for as long as I could. And that tired me out to the point where I just physically couldn't get angry anymore. But I think also to the point, kind of what Susan was talking about, where you have this dynamic between a parent who's trying to help their kid and their kid's getting angry at them and lashing out. God, I know I told my parents so many things that in hindsight, it was terrible. I would curse them out. I would say awful things to them. And I can't imagine what they felt when they heard their kids say stuff at them like that. But as I progressed through treatment, we just started to kind of separate the second that I could feel OCD taking over an interaction. And I would just go to my room and they would go somewhere else. And, anxiety can only last so long. Rage can only last so long. So I just sit in there. I would do whatever I needed to do, not compulse, but just kind of sit with the rage, sit with whatever I was feeling until it could come down and I could speak with my parents and tell them what was going on in my head. Because trying to extract information for someone in the middle of a rage just isn't going to go well.
Go ahead, Dr.
We used to actually send Megan to run around the house even when she was 7 years old. We'd be go run around the house twice and then you can come back and talk to me.
Nobody made me run, so regretting that now. It seems like a good strategy. Dr. Khemlani, so we are talking about a lot of kids and mothers, but obviously, adults, have a lot of anger and rage issues, either with significant others or themselves. I think there's so much information and comments and conversations going on. It's got me thinking so many things. I think I want to ask you one. A lot of people are asking how can we deal with anger and rage, or how do I deal with anger outbursts? And I think the first thing we need to touch on is the same as how can I help with this compulsion, is if you're not in treatment or in therapy, try to seek out a clinician, right. and get tools right. But specifically, for those that are trying to work on things on their own, or that are currently in treatment and really struggling, from a clinical perspective, what are ways in which we can try to manage our anger and our rage when we feel that coming up, or shame in that matter? Because I think all that is interconnected.
Sure. I mean, I have a bunch of strategies. I think in general, where behavioral therapists start is a good solid assessment. So sometimes we send our clients home with an assessment sheet, kind of a self-report, to build some awareness of what their triggers are. So if you're having anger and rage, to really sit down and kind of journal it. When am I angry? What triggered it? What was the situation? How long did it last? To get in touch with the external and the internal triggers, to do a good assessment of it to begin with. right? That's like a good starting point, is what makes me angry. Because a lot of times when you're feeling that emotion, you're not sure. Maybe it's always in the evening. Maybe it's when you didn't have a good night's sleep or you didn't eat. So sometimes there are these external factors that we may not be aware of, but they're patterns to our emotional experience. So I think that's one thing to work on. I mean, certainly, I wish I could teach cognitive therapy in just a few minutes, but to learn how to identify those patterns of negative or extreme irrational thinking, and to see if you can kind of catch that thinking, challenge it in yourself, and find a better, healthier alternative way to see things. And I think that works for anger and rage regardless of OCD or not. One great skill I learned from dialectical behavior therapy and that I use with my clients all the time is the ice pack strategy. I don't know if any of you heard that. Exercise is a great thing. Ice packs are something that just you can grab from your fridge, put them on your face. And apparently we have a mammalian dive reflex. So when we are plunged into ice cold water as mammals, just like seals and everything, apparently physiologically we start to calm down. Our heart rate goes down, our blood pressure, our respiration. So putting an ice pack or dunking your head in ice is actually a great way to bring down your emotion temperature.
So if you live in the north, you're set.
Exactly.
I actually did.
I could go stick my head in the ice outside.
I remember, I was taught ice cubes when I was at the OCDI because I would get you hold ice cubes till they melt, and it really brought me down. What's interesting is we're talking about this is there's so many ways anger and rage can manifest and who they're taken out on. I'm seeing people saying, "Oh, I get mad at my parents, I get mad at significant others." Other people commenting like, "I get mad at myself," and it's interesting because I can recall sort of my darkest days. And I'm sure Susan will be right back. She probably got angry and signed off. But I can remember some of my darkest days, and mine started with frustration, just at the idea that I couldn't get what I wanted, meaning the compulsion, that people didn't understand me, that and I'm specifically talking about when I was in residential treatment, and I was so scared to do ERP and so convinced that I believed so strongly in my own thoughts, and that the fact that they didn't understand what I was going through, or they didn't understand that how real my thoughts felt, or they were getting it wrong. And my anger manifested it was outbursts, but I wasn't angry or raging at them. It was just, I don't know who I was angry. I was angry at me. I was angry at the world, life, my disease, my disorder, but I just remember being so dysregulated. And I'm thinking about it now because I never saw it as anger or rage, but it totally was. I mean, I was crying, I was upset, I was frustrated, but I was angry and I was raging out. And I think that was part of the dysregulation. And it wasn't specifically, like I said, directed at somebody. Like I wasn't, attacking anybody or screaming at them. I think just deep down, I was so tired and so frustrated, and I just didn't understand what was happening, or what was happening to me, even if I was educated. So it's very interesting the ways anger and rage can really manifest in a variety of ways. And Dr. Khemlani mentioned dialectical behavioral therapy, which down below somebody commented about starting DBT a couple weeks ago. And yes, it is very effective. It's a great modality of treatment for emotional dysregulation and anger and rage and all that stuff. So I love that Dr. Khemlani mentioned that. I have so much more I want to say, but as you guys can see, the comments are lining up. So I really want to kind of get to some questions, but I do want to throw it out to Dr. Khemlani, Kyle, or Susan, if there's any other points you want to talk about before I jump in that we didn't immediately touch on.
I would say comorbidity, the research that people with depression and OCD have a more likelihood of being irritable and angry. I think in kids with Tourette's, attention deficit disorder, they can come with impulsivity and anger and rage. So that can compound the OCD as well. Perfectionism, I could go on and on, checking behavior. Sometimes if you interrupt those. So to look out for that as if you're a parent and you have a child with not just OCD, but these comorbid conditions that go along with it. So that would be one common.
Go ahead, Kyle.
Yeah.
Do you mind if I go on like a real quick little digression? I promise it's relevant.
It's got to be good. If it's not, we'll call you out on it. Go ahead.
All right. So when I saw the title of this town hall, I immediately associated anger and rage with like getting mad at someone when you're going through OCD thoughts. But then I thought about it a little more. And I just wanted to touch on a part of anger and rage in relation to OCD that I actually found helpful. My best strategy for fighting OCD was to get really, really mad at my OCD. And I would work myself up to get really, really angry. And like, I got to the point where I could get a rage going at my OCD. So anger and rage is awful in the context of getting mad at other people, but it can be a really effective tool at beating back your OCD. And like, just the same, like I would use music to calm myself down. I would play Eminem to get mad, to fight. So it can be helpful in that sense.
I always knew Eminem was a bad influence on you kids. No, I totally agree with you, Kyle. I think that's such a great point, is redirecting the energy and using it for good, instead of Sony, did you have thoughts?
No, I think that's wonderful. It's like, as I always say, it's like us team against OCD, right? We got to get on the same team, especially with my kid patients.
Yeah, absolutely. For sure.
I liked
go ahead, Susan.
Sony's comments about comorbidity. I always struggle with that word. I got it out on the first try. That was very impressive. My daughter also had quite a few autoimmune diseases. And so managing her health was always a really big challenge as well, kind of going along with the OCD. But we ended up in some great places for kids who had, issues tolerating clothing, having sensory integration challenges with noises, all kinds of different things. And we learned some interesting techniques there that, at least for little kids, although kind of we still find it works, did help, similar to the kind of ice cube trick. Some of the things were, actually doing a handstand, which my kid can walk across like a football field now in her hands, which is
that's awesome.
She's like a serious, like little, it's like she literally in college, people are like, you can do what? She's like, yeah, watch. But when she was really starting to get worked up to that, as we kind of learned what her triggers were, she would literally ask if I would hold her upside down, and I would hold her upside down and swing her. We also learned a lot about movement and swinging, and so did a lot of things like that. And then often found, like, right as she was starting to get worked up, for when she was little especially, if I would just say, I'm not going to discuss this until you eat something. And we always had peanut butter and crackers in my purse. Like, to this day, I still carry them in my purse because I have little trauma around that. But if we could get her to pause for a second and eat, it would stop the cycle, and also was often what she really needed. So those are just a few things we found helpful.
That makes a lot. Yeah, that makes a lot of sense. I lost my train of thought, which occasionally happens to me. I was going to ask Dr. Khemlani a specific question. I'll have to come back to it because I don't want to keep you all waiting. But I think I want to jump into some questions and comments, because we've really got a great discussion going here, and I think this will lead us to some really good conversation. So thank you all for being patient. We'll try to get to as many as possible, and I'll start back at the beginning. So at 7:07 p.m., Reed Frankhauser said, so obsessive episodes where I get worked up and hyper-focused, get angry, get scared, or move quickly, have any correlation to mania? I'll throw that out to you, Sony.
To mania, I mean, it can be. I think I would say to get a trained clinician to try to tease that out for you, because hyper-focus, getting angry, can be signs of a manic episode. They certainly can also be OCD, so it's hard for me to say.
And with that, go ahead, Sony.
Oh, I was saying, people sometimes in a manic episode do kind of have this hyper-focus and repetitive thoughts. So sometimes that's like a diagnostic kind of distinction to make, and it's not an easy one to make.
So when do we want to look at, I'm going to tee off on that question, which is, when do we want to look at anger and rage as possibly not specifically related to OCD, but may in fact be some other comorbid mental illness or condition associated with it in terms of acting out?
I mean, I think as a clinician, we would take out our OCD kind of diagnostic tools. I would take out the Yale Brown Obsessive Compulsive Scale and give it to somebody. And if they have particular, obsessive, repetitive thoughts that were more typical of OCD, then I would also consider that as a diagnosis in addition.
Thank you. Christina asked, how do I help my girlfriend with OCD? Christina, I'll just quickly, I would encourage you to visit the IOCDF website, which is iocdf.org. Treatment is the best way, but there are also amazing self-help options as well. The IOCDF website has a ton of amazing resources. I would start there. IOCDF.org will also post the website later on. It's a big question to answer, but definitely treatment is the #1 way. And then if you have additional questions, we'll definitely give out some emails and we're happy to answer them for you. But thank you for that. I appreciate it. And she also wrote, thank you, Kyle, for sharing your story, as always. Mindfulness, Shaitana wrote, mindfulness is one of the best things that has helped my OCD. I couldn't agree with you more. William Hillard at 7:15 p.m. Sorry, I'm kind of speeding through, but I know I want to try to get to as many as we can. What can you do when you are attempting to calm yourself down and at the bottom of the rabbit hole, your OCD tells you that if you were having bad thoughts in the first place, they must be true? This is such a great question, and I know it's so common. Kyle, I'm going to throw it to you first of all.
Oh man, there's a lot to talk about. Let's see, how to calm yourself down. The first thing I always do when I'm at the bottom of a rabbit hole is I think about my values. That's always what I go back to, pretty much in any circumstance. I just think about where I want to end up, who I want to end up with, what kind of person I want to end up being. And I think, will following this thought get me there? And I know that if I follow my contamination thoughts, I'm going to end up alone in a room and not have much of a life to be living. And that thought makes me feel a lot better and can help me out of the rabbit hole. But that doesn't mean that it stops the anxiety, and it doesn't stop the anger, and it doesn't stop any of the associated emotions. It just makes it a little easier to tolerate because I know that I'm doing it for a reason. So I'd encourage you to do that first. And then with all the emotions and the anxiety, the thought I always go back to is, this too shall end. It can only hang with you so long, and it's awful while it's around, but it does end. And that's a thought that provides me a lot of comfort.
Dr. Khemlani, how this, I just love this because I relate to this so much, and I have a feeling so many people reading and viewing this relate to this as well. First of all, how common is this? And second of all, what are some great practices we can use? I think there's so often that, like, well, if I had the thought, it must be true. You know, that thoughts are facts. What are some skills and tools or way he can reframe when we are down at the bottom of that rabbit hole? Because I'll add, I know I'm talking too much, which happens when I'm tired, and I apologize to everyone here, but I don't want reassurance that I'm doing it or not doing it. Either way, what I will say is that when you're down at the bottom of the rabbit hole, William, your lack of objectivity and insight is really low. It's just hard to know what's going on and have that insight to be able to do some of what Kyle's talking about. So with that, Sony, take it over.
Oh, there's a lot here. I would say depends where you are in your treatment process, right? If you've done your good ERP and you have your tools, you can pull those out and say, OCD is a bully. I can't, I won't believe these thoughts, get lost. That is just lying to me, right? So you can have sort of your toolbox of strategies to pull out at those moments. I think thoughts can feel very real, but like you said, thoughts and reality, can be very distinct kind of things. That when your OCD gets a hold of you, it finds loopholes in evidence. So I would not necessarily try to find logic in that moment. I would try to sort of sometimes say, boss it back. Again, if you're in that phase of treatment where you can say, I'm going to boss back my thoughts. But I love what Kyle said too, is to pull out those values, pull out what's important to you, and know that if you went down that rabbit hole, you're just going to feel worse and worse. So I think those are great strategies.
I have some thoughts as well, but before I jump to them, Susan, anything you'd like to add?
No, I thought that was great. It really does. I think all of us were like, "Ooh, that's a big question." Because it is a big question. Like, we could start at the beginning of like, what's you and what's OCD and how do we identify that? And then we need that in order to be able to talk back. So there's a lot there. And I think I would say back probably, do you have a treatment provider? And if you do, that's a beautiful question to take in with them on your next appointment. And if you don't, we have a website that I think Fran can post in the comments for us for where you can find a treatment provider. And the bright side of COVID, I guess, is that there's a lot of treatment providers that are now working online, and depending on your state, you may even be able to go across state lines. So you can get some great access right now to folks. And I would strongly encourage you to get help because you do not have to do this on your own. and a great treatment provider will give you the answers you really need for that, for the stage that you're in, so you can start to be at an easier place.
Absolutely. Thank you, Susan. Shiatana wrote, thoughts are not facts and have no bearing on who you are as a person. I love that. I would just add two things. I'm going to take an acceptance commitment therapy or ACT approach to this, which is one, I love the idea that thoughts are thoughts, because I think we can get into this idea of like one thought is just a thought, but another thought must be true when it's just another thought. And so, you know, I love the approach of like, yes, you go down a rabbit hole and you're calming yourself, but then your OCD tells you that if you're having a bad thought in the first place, they must be true. But that's also just a thought. So for me, identifying it as all thoughts, which aren't facts, and therefore, and it gets kind of heady, but it's this idea of also the same as like, well, I'm never going to get better. I'm so sick that nothing's going to work. Well, that's just a thought too, even though it seems real. The other thing is, you know, everything around what Dr. Khemlani was talking about where you are in treatment and therapy, if you have some education, is this idea of living with uncertainty. And what is your ability, William, to sit with the possibility that maybe they are true? Probably not. It's probably OCD, but I'm willing to live with the uncertainty, or not having certainty around the fact that these thoughts may or may not be true, and really embracing this idea of coping and living with the discomfort of uncertainty. Those two things for me work really well, along with Kyle nailed it, identifying values and really choosing what you want, which is a great way to be. Jason Croppinger, who's a therapist at the OCDI, I loved this, but you know, he talks about when you're really depressed, it's hard to identify your values. You know, when you're in this state, but you know, OCD attacks the things that are most important to us. So we can usually use the rope that OCD is dangling to kind of find where our values came from. And I love that, because if you're kind of in the depths of your crap and in the bottom of the rabbit hole and all you can see is OCD, sometimes you can follow that OCD back to your values to be reminded then what's important to you, and then help that get out of your hole as well. I normally like to take credit for really brilliant things doctors say. I did give Jason credit for that, but normally I'll just take credit for it. I thought it was good. Yeah, for sure. Let's see here. Caroline, I think that's how you pronounce it. We did touch on this already. She just said, can you tell me anything about anger attacks? I'll go ahead and ask it. I watched a video the other day about how people with OCD and comorbidities, panic attacks and depression specifically, can have anger attacks. Can you tell me anything about why that happens? I know we already touched on this to some extent, but if there's another brief way we can touch on that, Dr. Khemlani.
Sure. I think, you know, panic attacks and stuff are physiological arousal. We're talking about, like Susan said, it's the fight or flight response, right? Most of us think of flight, like we run away, we avoid, or we freeze, right? Like a deer in headlights in the moment of panic. But the other side of the coin is fight. So it's like a caged animal. They're really scared, but they want to fight their way out. And if you think about somebody with OCD thoughts, they're in the moment of thinking they're going to die, somebody's going to die, like something really awful, terrible is happening, or they're a terrible, awful person. So in that moment, they're looking to fight their way out. So that's why you see a lot of panic and physiological arousal, because they really, especially if you believe in the moment, you believe your thoughts, that bad thing really is going to happen. Obviously, you can be in a state of panic.
You know, there's something else that happens, which is interesting, is that, you know, like Kyle said, it's all about not engaging. You know, it's not engaging your thoughts, not engaging the OCD. And in a way, it's also about not engaging the anger, because we can get angry being angry and angry at our anger, which is a little twisted, but at the same time, it's true. You know, if we can accept the fact that we're angry and not resist the anger and sort of sit with it and sit with the discomfort that anger is, you know, the anger will subside a lot quicker than if we continue to just be angry that we're angry and resist. And if that makes any sense at all. So just throw out that little nugget. Susan, did you have something to add? You were nodding.
No, I just thought you were going to go straight for the Buddhist route there. So
I say that for Dennis Turch. He is the man when it comes to that. But we can. So Eric Broach at 716 wrote, with certain themes of OCD, like just right or moral scrupulosity, you might have a lot of anger, rage aimed toward yourself. What's the best way to deal with that? I love this question. And thank you, Eric. I'm going to start with Susan.
Yeah, I mean, I think Ethan was talking about it earlier. There's some great acceptance and commitment therapy out there that really does help to address this side of things. It's tough when you feel angry at yourself, especially if OCD is telling you that there's something wrong with you. Like, I think that's one of the worst feelings you can have in the world if you're pretty sure like no one else has figured it out yet, but you know. That is, you know, that's tough. I think it's one of those feelings that all of us have at some point, so we can really relate to it. And I feel, you know, I'm glad that those thoughts, when I think I'm the worst person in the world, the worst boss in the world, the worst mom in the world, I'm glad that thought doesn't repeat thousands and thousands of times over in my head a day. So having that, do that. Let's say it was about parenting, because that's always a weakness for me. You know, am I a bad mom? If that was coming into my head all the time and making me feel really bad about myself, then to Kyle's point, it would be hard to get back to my value system, which would be, you know, being the kind of mom that can pause and be kind to my child. I think for me, I'm able to sort of a lot of times think, well, how would I want my child to be treated? And then treat myself in that way. Because I think I can only mirror that. That's a value question. So I think doing some really good therapy to get to the point when you can be loving yourself. I saw a bunch of questions about this in the side, and I was like, oh yeah, this is hard. It's really hard when you're angry at yourself, when OCD is telling you horrible thoughts at yourself all day long. Like, imagine if your parent all day long was telling you terrible things about yourself. Like, that would be really hard, right? Well, OCD is kind of like a parent in your head, right? It's this illness where those thoughts that come through all of our heads are suddenly repeating over and over until you're like, how do I not believe these? So I think really going to some therapy and talking about it, and then slowly developing that really strong value system where you can know that you love yourself and that nothing that anyone says that is bad about you can possibly be true. It's actually a great way to fight back OCD, because once you are clear about that you are a beautiful, loved person that is meant to be here and be exactly where you are, there's nothing bad that OCD can say to you anymore, because you'll always be able to say back, I'm a beautiful, loved person who's exactly where I'm supposed to be.
I love that, Susan. That's awesome. Kyle, anything to add?
Yeah. Two things. One, I just think like linguistically, it's interesting how the question's phrased, as in like, I'm mad. My OCD is telling me to be mad at myself, therefore I'm mad at myself. So my first recommendation would be like, well, you're not mad at yourself. Your OCD is mad at you. And then you can get mad at yourself if your OCD is mad at you and you want to choose to follow it, but that's kind of a choice right there, right? So I think one thing that's really important in this discussion is dissociating from your OCD and saying, look, I'm Kyle and I have OCD, but just because my OCD is mad at Kyle because Kyle touched like that banana peel, that doesn't mean that Kyle's also mad at Kyle because he touched that banana peel. They're two separate entities. I've lost my other point. That point though was stuck.
Eric, if you can send your address, Kyle will send you an invoice for that. So, Dr. Khemlani, anything else to add as well?
I think that's I think the first part of the question, the just right feeling, I think that's a very difficult kind of symptom also in OCD, because there's not always like this clear somebody's going to die consequence. It's just this internal itch is sometimes how I describe it, to keep repeating actions until they feel right and you continue to feel wrong. And sometimes the consequence is that I'm just going to feel this discomfort forever. And that can lead to a lot of just frustration, rage, because it's so arbitrary. You know, sometimes with contamination or checking, you know that the stove is going to trigger an OCD episode for you. But the just right it can come on arbitrarily throughout the day. It could be you're perfectly fine, and then, you know, you pick up a glass of water and it just didn't feel right. Then you put it down, then you do it again and then over, and you can get stuck in this loop. So I think that causes a lot of frustration as well.
I love these town halls. Thank you, Sony, so much. I love these town halls because then I don't realize how much a subject pertains to me until I start talking about it. And I'm like, oh my God, this really relates. So some town halls are really quiet, and other times I'm not. Two words that are often hyphenated: self-compassion. For me, that was a game changer with anger and rage. There's a lot of amazing self-compassion content out there. I encourage you to seek it out. For me, learning self-compassion and self-compassion technique was like learning Japanese backwards. It's just not a natural language for me. I'm used to beating myself up. I'm my own worst critic. And as Susan said, you know, parent, I have the salesman in my head, and it doesn't matter how many times he's been wrong. When he tells me that I'm a crappy, horrible person, I go, you're right. absolutely, I am this horrible person. And then when I finally realize that I'm not, I'm like, oh, that was just that stupid salesman. Because if he was outside, if he was a car salesman and you walked into a dealership and he talked to you like that, you'd be like, I'm out. I'm calling the manager. Screw you. I don't have to listen to that. But the car salesman in your head, you're just like, you're right. I had no idea. But it doesn't matter how many times I disprove. Go ahead, Susan.
I think, like, when I think about that too, I also think with OCD, sometimes it is sitting with the anxiety of the thought and saying, yes, it might be. So there's like self-compassion and like talking kindly to yourself. And then there's also like, maybe I am the worst person in the world and I get to start over today. And sitting with that for a while, depending on where you are at that phase in therapy, I just want to make sure that I'm clear that sometimes, you know, when you're doing self-compassion, you're like, wait, am I just reassuring myself and slowing it down, blah, 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 especially if you're getting it from anyone else. So I just want to make sure that I'm talking about that a little bit, that eventually as you work through therapy, and it'll be baby steps to get there, it may be sitting with it. One of my daughter's biggest fears was that she would throw up. And so if you sort of think of that as the same thing as a voice in your head saying you're a horrible person, and you get a voice in her head saying you're going to throw up if you do X. And it was any one of a million things, including talk at the breakfast table, for example. So not like normal-ish things that we would think of that would make you throw up. So same kind of thing. Ultimately, the therapy for that is to sit with the fact that you might get sick. You might get sick. You might be the worst person in the world. And then sit with it and say, you know what, value system is I get to start over today, and that's where I'm going to go. So I think that's an important part of it. It's just, you want to do that with a therapist so that you have a nice, safe space to do that within, and that you can work your way up to that.
And I'm going to think I'm the crappiest person in the world living my best life until I'm proved otherwise, you know? So it's like, it's hard to do. Go ahead, Sony.
No, I was going to say with exposure, I would say, so what? Big deal. Bring it on. Like, if I'm going to be the most unscrupulous person, let me have fun with it. Again, that's within the concept of doing flooding scripts. And if you're in that phase of exposure therapy, it's very liberating to say, great, I might as well have fun being unscrupulous and the worst person.
And in general, I'm just seeing so many like emotionally loaded questions and comments. There's a lot of stress and tension and anxiety with a lot of people watching and viewing. So the first thing I'm going to say is just all of you, if you're really struggling during this time, because I know a lot of people have mentioned that they're struggling right now in this moment, you know, take a breath, know that you're supported, and we're here for you the best that we can be in supporting you. Please go to the IOCDF website. There's tons of great support diagnostics tools, information, insight, you know, and also I encourage you to don't hesitate to email the IOCDF. If you have questions, they will always get back to you. If you have questions for me, Sony, Kyle, or Susan, you can email through the IOCDF and we will get back to you. But the number one thing, and Dr. Khemlani is hit on this numerous times, the number one thing you can do for yourself is seek treatment. If you're struggling right now, because I've read a few people that are really in some dark spaces, if you're struggling right now and, you know, and you feel like, you know, there's no hope and OCD has really got you, you know, seek treatment, seek help. You know, and if it isn't near you, Susan made a great point. COVID, one of the silver linings is virtual. Everyone's virtual. So nothing has been more accessible than it is right now. No CD is a virtual therapy service. Their costs are a fraction of therapists. It's a free download. It's a free app in the Google Play Store, the Apple Store. Check it out as well. And honestly, now I think they're insured in all 50 states or almost all. So I think insurance takes a lot of their as well. So look into No CD and always reach out and don't hesitate. I do realize that treatment is hard. Go ahead, Susan.
I was just going to say that I think a lot of these questions feel like they're around scrupulosity. And sometimes I think it's helpful just to know that something has a name. And so I was going to ask Sony if maybe you could define scrupulosity a little bit. And then I'd be happy to touch on what that might look like for little kids as well.
Yeah, I think scrupulosity is sort of like moral OCD. It can have religious components and it could not. It could be blasphemous thoughts, like having, terrible thoughts against God. It's feeling like a bad person, like an immoral person. It could be, I'm going to be punished by God. So it can take many manifestations, either from a religious like scrupulosity or just this hyper morality piece, and really feeling, I think people with scrupulosity do feel like terrible people. You know, they feel like they're going to be punished by God somehow. They're going to hell if it's religious, or just I'm failing people, I'm failing my family, I'm just never going to be accepted in society. So it has this kind of like personal identity component to it that I think makes it very painful to experience.
And I think it's really common within OCD to have scrupulosity. And a lot of times people don't realize that like a lot of people are having those kinds of thoughts, which can actually help you to fight back against it, to know that you're not alone in that. That is a very common type of OCD, for your OCD to tell you that you are a bad person. Sometimes that's within a religious context. Sometimes it's not. At 6 years old, my daughter was coming home and confessing, which is something that we see a lot in scrupulosity in children. So she would come home and confess that she had been really mean to a kindergartner, which clearly was not acceptable. And the first couple days that she came home and confessed this, we would sit there and talk about how she could do better and how to apologize. And then, by day 3 or 4, I was like, so you seem really upset that you have been mean to these kindergartners, but you keep doing it, or no, is this really not happening? And that's when we really realized that she had scrupulosity, and that even at 6 years old, her mind was telling her that she was doing bad things and therefore was a bad person. And her, a lot of times people say, well, that's pure and there's no compulsion to go with that. But certainly for us, we saw that her compulsion was seeking reassurance, was talking about it and asking if she was a bad person, or even if she had done those activities. So that confessing was what her compulsion was. And so a lot of times with OCD, when we're talking about the therapy, it's not necessarily the thought that's the problem. We're not trying to stop the thought, okay? Because like, I'm going to tell all of you guys to stop thinking about pink elephants. I'm pretty sure everybody just had a pink elephant run through their brain, right? So it's really, except for Ethan, who went purple. Oh, you did, Ethan. So it's really not about the thought. The pink elephant can wander in and out. It's about the action. It's about the behavior. It's about slowing down the compulsion. And that's what you'll do in therapy, and not in a scary, hard way. It will be hard sometimes, but you can start with it very slowly. And what it does is it changes the behavior over time. And it's pretty cool. We've done studies to show that exposure and ritual prevention therapy is as effective in changing the brain and what happens in the brain as medication can be. So whether you're combining medication and ERP therapy or just doing one or the other, it really can have some chemical changes in the brain that will slow the thoughts down, but more importantly, help you not to do the behaviors that are making you feel like you're losing part of your life. And that's really what we want here, is for you to have a full, happy life. Bad thoughts happen, anxious thoughts happen. The question is, can we move through our life with joy?
Thank you, Susan. Well said. Kyle's aching to speak. I can feel him.
Go, Kyle.
I mean, to be honest, I want to stay in my lane. Scrupulosity, I don't know too much about it. I'm more of a contamination person myself. I don't want to give anyone bad advice.
Megan was lucky. Other than like flipping light switches or checking the stove, I think she had all of them. So.
Well, Kyle, you need to diversify your OCD portfolio.
Right.
So, the one thing I'll add to that, wasn't an extremely stigmatizing comment. The one thing I want to add to this conversation is I think it's important also to recognize when you have OCD and anxiety or any mental illness, it's so easy to blame everything on OCD and anxiety and mental illness, when in reality, we're going through a tough time right now. Things are really difficult. There's a pandemic, everything that was happening with the transition of power and president. It's stress. Life is stressful. And sometimes it's not OCD and anxiety. It's life. Life can be hard, and life can make you angry and frustrated and upset. So I think we have to continue to give ourselves grace and compassion around this idea that not everything has to be about OCD. Sometimes you're just angry or upset. I also know, because of all these town halls and the research, that individuals with contamination and moral scrupulosity have been hit really hard with COVID. Whether obviously you have health anxiety and you're afraid of getting it, or moral scrupulosity and you're afraid of giving it, or what if I accidentally gave it to somebody? There's so much over responsibility around COVID and keeping people well and safe. So for those of you that have a lot of moral scrupulosity, being overly triggered right now, your baseline is probably elevated from what it used to be right now. So I think we also have to acknowledge the climate and the atmosphere and everything that's going on. And again, also grant ourselves grace and self-compassion around that, and know that we probably have to work a little harder too, to kind of manage our symptoms and our anger and all that stuff. So just a little added piece. This is a really, really great question. I'm excited to ask this question. And by the way, on this stream, when a lot of people comment, thank you for all your comments, suggestions. Everybody's engaging. It won't load the questions back in. So if I skipped your question, it was not on purpose. And again, feel free to email me and we'll get back to you. But it's starting to skip people's questions, so I apologize. At 7:23 p.m., this is the gist of her question, but then she asked it outright. Helen asked, so good. My child, mostly pure O, and let's define pure O right now, is mental compulsions, rituals, usually intrusive in nature of a sexual, violent, intrusive thought, taboo. Okay, is transgender. But I've read about TOCD, where your OCD tells you that you are transgender. He is starting to have doubts and now says that he has battling thoughts in his head and doesn't know what's real and what isn't anymore. He's going forward with chest masculinization surgery, but is now wondering if he's doing the wrong thing. And then she asks the question in the next comment, how common is TOCD and how do we know what's accurate and what's intrusive thoughts? I'll start with Dr. Khemlani on this.
That's a very big question. You know, we're hearing a lot of children, I think, just in their development, questioning not just their gender identity, but their sexual identity. And I think at the beginning phases of adolescence, there's a lot of questions about it. And for kids who are also having OCD about it, it's very hard for them to distinguish, and for parents and I think clinicians to distinguish for us what is kind of a typical trajectory of questioning your sexual and gender identity and what is sort of an OCD repetitive aspect. I would say to seek out a very clear trained clinician who's very familiar with transgender and adolescence and these emerging questions from developmental perspective as well as an OCD perspective, because I think it evolves and it takes time to figure that out. Because somebody who's truly questioning their, I think, gender identity can have a lot of anxiety and questions about it too, which may be OCD and it may not be. So I would say,
Susan, go ahead.
No,
for some reason I love to interrupt you at the tail end of what you're saying. It's my new thing. Susan, do you have anything to add?
Yeah, that's a very complex question. And I just want to say I have a lot of empathy for you in trying to figure that out. I'm not sure how old your child is. So I think some of that, it could be an adult child or it could be a younger child. I think probably if there are serious questions and there does appear to be some OCD in the picture, before surgery, I would be looking for really good therapy. So I completely agree with Sony on that. And I would be very comfortable postponing a surgery that can be done at a later time while I figured that out. So I think that's the first thing I would say. We see similar questions in the plastic surgery field where someone has BDD, which is another type of OCD, body dysmorphic disorder, where they, similar to anorexia, will see a part of their body in a completely untrue way because of their OCD. And so they might go into to have plastic surgery, let's say their nose, if they think their nose is absolutely unacceptable. So if, in that kind of case, if they're talking with a surgeon and that surgeon does feel like there's anxiety or OCD there, then I think it's a good thing to pause and just check that out and make sure, because, we certainly do not want to have surgery in a place where that may not be our truest self. And even for a little kid, I'm always like, is this you or OCD? Can we talk about that? Do you want to do this or does OCD want you to do this? And until you're at a healthy place where you can tease that out, personally, as a mom, I would discourage surgeries until we're ready to understand the answers to that question.
Typically teams of professionals who work in transgender, like in hospital systems, have a team of multidisciplinary professionals who can help figure this out. I mean, I would say for the few clients I have treated with, say, gender identity and kind of from an OCD point of view, there is a feeling of this is an intrusive, ego dystonic thought. It's not something that I think of, that I want to think about. It feels very much like, what if I am? So sometimes you can tell, like the what if, the intrusive, it's egotistonic, it doesn't feel that way. And when you question whether they've made any real steps towards being transgender, such as, exploring change in clothing and change in name, which may be typical of somebody questioning their gender identity, people with pure OCD about it are not necessarily engaging behaviors towards that. They're kind of running away in the opposite direction. So if that's at all helpful.
And I want to transition that back to the thought of anger and rage too for just a second, that, because that's our topic this evening. But I want to talk about that sort of that thought, like, we don't know the answer to this question. We hope you get really good help on it. But like, for example, if we have a new mom who has postpartum OCD that maybe makes her have bad thoughts about harming the child, and then family members are asking her to bond more with the child or spend time alone with the child, you can sort of very easily see where anger and rage would come out of that. I think the same thing would be true with a child who is thinking about, whether it's sexual identity or gender identity, and then maybe actions are being asked to be taken, or you may even be being very supportive of that. But, if you're being very supportive of a sexual orientation that's actually an OCD thought, that can make that person very angry, because it's like you're not seeing who they are really. You're listening to the OCD instead of them. So that's like a really tricky little thought thing there. But that can be why you're sometimes seeing that kind of anger and rage. I see Kyle laughing at that, smiling at that in recognition.
Mm-hmm.
Go ahead, Kyle.
That's just an incredibly complex and sensitive topic, and it seems really difficult to parse out. My only suggestion would be talk about it when OCD is kind of letting up. Like, I know when I was in treatment, there would be times when my OCD really wouldn't be bothering me, and that's when I would have the best insight. And maybe that's by way of like saying for 15 minutes on Monday, like, we're going to talk about this. We're just going to try to have like the best civil conversation we can about this. But I think that's going to be the best opportunity to parse out what's OCD and what's not.
Yeah, absolutely. And I think first of all, Helen, thank you for that question. Second of all, when I said I love this question, I simply meant it's an important topic that needs to be discussed. So, and no way excited that there's doubt in anything going around it. Also, if I'm reading the question correctly, he's starting to doubt that he's not transgender. So just, I can tell you that that there was somebody that I supported for a long time as an advocate who had finally come out as gay, and he was a man, and he'd come out as homosexual, and it was very difficult for him to come out, but he came out to his family, his church, he switched churches, he made all these life changes, and immediately OCD attacked and went, but what if you're not gay? What if you're straight? We hear a lot about, HOCD, but for him, it was the opposite. It was like, you've done all this stuff, but you could be straight. So then he spent so much time compulsing around testing whether he was gay, whether he was straight, and so forth. I think I just saw this. And to that point, I think Katie made a great comment down below at 7:30 where, if someone identifies as transgender or non-binary, the journey is so incredibly important to their core identity. Therefore, it is a big, wide open space for OCD to make them doubt themselves. So I think that's a great point as well. So just definitely all food for thought. Let me scroll back up. Okay. I lost my place. I apologize. Somebody talk quick.
I think you're doing great, Ethan. I know the chat's hard to moderate tonight. So many comments. Usually
it's, but yeah, it's interesting for sure right now. Somebody wrote, yes, I was going to comment on this. Helen also wrote, dialectical behavioral therapy, I think, along with ERP, is the only proven therapy that worked for OCD. A therapist needs to be trained and specialized in it to use it. Catherine, am I correct? You may be responding to Catherine. I will say, and obviously I can let Dr. Khemlani really weigh on this because she's the clinician. But I will say that, exposure response prevention is the gold standard evidence-based treatment. But with that, acceptance commitment therapy is also an exposure-based treatment, and commonly accepted as an adjunctive treatment, but also there's a lot of research to show that it works as a mainline treatment as well. But in conjunction with each other, they're both extremely effective. Dialectical behavioral therapy doesn't necessarily treat the ERP, but treat the OCD. But it's very effective in managing emotional dysregulation, which in then turn, if you're less emotionally dysregulated, you can then really engage much more effectively in ERP and ACT. Do I have that right, Dr. Khemlani?
Yes, I mean, ERP, CBT, those are our first line treatments. We go to these adjunct treatments when we're hitting roadblocks along the way, whether, when there's comorbidity existing that needs to be addressed, when the person is really fearful of engaging in the ERP, when there's a lot of treatment fear, treatment resistant, or there's a high level of belief in the beliefs, like having high overvalued ideation, then we kind of pull from additional resources. It's kind of our toolbox. But if the first set of tools isn't broken, I won't reach for the others. If ERP works with CBT, that's my first line. I try not to play alphabet soup unless I really feel that the patient could benefit. Otherwise, it's confusing. So I go with, first line, gold standard treatment. If I feel that there's a true need, I think there are wonderful techniques to be learned from ACT and DBT. And you're right, they are exposure-based in some ways. Anyway.
And also, if great behavioral therapists, a lot of those modalities of treatment they cross over, and there's a lot of qualities of ACT and DBT that are already built into ERP as well. And so, but yes. Yeah. CC at 7:29 p.m. How do I manage the intrusive thoughts when the voice of the manifestation is so powerful? It's truly agonizing. Great question. Super cute cat. Kyle.
Ethan, you give me the hard questions. Well, that's not to say the last question.
You go to Yale. What do you want from me?
I mean, there's a PhD over there. Let's see. First, it's truly agonizing. Yeah, I will agree with that. It is very, very agonizing. Let's see. I was talking about this with my therapist the other day, and we were talking about kind of the beginning of my OCD and how it's transitioned over the years. And we're talking about it when I was at the very lowest, and when the voice that was causing my OCD was the loudest it had ever been. And she pointed out to me something that I never really had thought about, but I had always assumed going into treatment that one day it would just kind of click. Like one day I would be doing ERP and I'd be like, oh, wait a minute, this is easy. And then I wouldn't have OCD anymore, or that the exposures would be easier. And she pointed out to me that it was a really long road that I went through. And it was really, really small baby steps at first. And they seemed really insignificant to me at the time, but they added up over time and they took the power out of that voice. So that's kind of an anecdote, which goes into it's really powerful right now, but baby steps are the key. And for me, I just had to chip away at it constantly. And eventually it lost a little more power and a little more power and a little more power. And then it became a little easier to do the harder exposures. And then eventually I felt more empowered to do exposures without the help of a therapist. And I got better and better and better until I could be considered recovered. So really the thing to do when the voice in your head is so powerful is just to think of the smallest thing, the smallest amount of uncertainty, the smallest amount of anxiety that you're willing to tolerate, and the smallest amount of that voice in your head that you're willing to say no to. And just try to do that exposure and work with your therapist to try to chip away just a teeny bit. And I promise it's going to feel like nothing. And the voice in your head's still going to be there. But I promise it does actually add up over time.
I love you, Kyle. Susan or Dr. Khemlani, anything to add?
We just did a whole session this weekend on with little kids on how to break down fears. And I love what Kyle just said. And I find a lot of times in the community that the big question is, oh, but this is my fear and how would I possibly break down? Or this is my compulsion and how would I possibly break this down to the smallest component? And I can't do this big one. So if you're feeling like that, definitely finding a therapist that can help you break that down is entirely possible. And we used a great example this weekend, and you could substitute any word in for the word egg. Okay. But if you're terrified of eggs and you believe eggs that will make you die, eating an egg is probably feeling like a really big step. Maybe even having an egg in your house is feeling like a really, really, really big step. Maybe being around people that are eating bread that's made with eggs could be possible as long as it wasn't in your house. Maybe walking in a grocery store is overwhelming, but sitting in a grocery store parking lot for 10 minutes could be a good thing. And that might be the level of anxiety that you can tolerate. And it seems like, you know, when you're doing it, you're like, this is too small. Sitting in the parking lot cannot possibly help me to get over my fear of eggs so that I can have breakfast again. But it truly can. Once you do that exposure, you'll be able to do something like walk through the grocery store, or sit with a friend while they eat that bread with eggs in it. There's always a way to break it down into a smaller step. I really promise there's always a baby step that you can take, that very, very first step. It's just a matter of finding it. And sometimes when it's your fear, I think it's easy for me to talk about the egg because I think eggs are great. But if, you know, you were talking about jumping out of an airplane, I'd be like, let's back it up. I'm not jumping out of an airplane. But like, I'm not triggered by that right now because I'm not up in the air. So I can think, well, I would be willing to learn how to release a parachute on the ground. I would be willing to do that. And maybe if I did that, I would be able to think about whatever the next step is, but I don't have to worry about jumping out of an airplane. I only have to worry about learning how to release my parachute. So finding someone that can help you find the smallest step is like the most important part of it. And whether that's a friend or family member that can help you be creative about thinking about those small steps, if they understand the therapy, that would be great. Or finding a therapist that can help you break that down would really be ideal.
Absolutely. Dr. Khemlani, go ahead.
Sure. I was saying, you know, a lot of my patients will say to me as we're creating this hierarchy and this list of fears, they'll look at the worst ones. And so I can never do that. So they kind of get stuck in the little ones, knowing what's coming, right? And it seems so daunting. And I say it's kind of like a game of Jenga, you know, that tower. As you pull out the bottom little like wooden blocks, the tower crumbles. So just work on the little ones, because once you get higher up, it won't feel as hard. So just trust the process of exposure, and those really high level exposures, like actually jumping out of the plane, won't seem so daunting. They do at the beginning stage, but once you've played with the parachute and you watched videos and you've even taken a plane ride and watched somebody else jump off, by the time you get there, you're ready. You can do it.
And I think everybody said amazing things, Cece, and thank you for that question, because I think everybody here probably relates to that in some way. So I think this benefited everybody listening, including us. I will just add that, you know, typically the bully is the loudest person in the room, but so, you know, I like to, and we always talk about OCD being a big bully, and, you know, the best thing you can do is to treat it like a bully and take its power away by just agreeing with it and being like, sure, okay, yeah, whatever, I'm all of those things, yes, and then, you know. But I also, at a certain point, started to reframe when that voice was very loud and powerful, because if it was loud and powerful, I could identify it for what it was. It was clear to me. I could point it and go, oh, you're OCD because you're super loud and powerful and really convincing. And I know you. I recognize that. And so, you know, when I have an episode or when I'm struggling, you know, and I get a really loud, powerful voice that's kind of going against my values, I always say, I've said it in other town halls, my OCD voice sounds like Bernie Sanders. It just does. It's funny to me. So I would also encourage you to, like, and Kyle talked about that the little voice, the little step. You know, I would encourage you when that big voice, that manifestation of OCD is really powerful, to go, hey, you're that powerful OCD voice. And then somewhere in there is also this very quiet voice that is the logic, healthy part of your brain that's probably telling you to lean into your values and discomfort and uncertainty. And I would try to, like, almost like a radio station. Well, I don't know, the old radio stations where you had knobs and things, where you can tune into that station and really listen to what that, in DBT, they call it wise mind. But it's this perfect, purpose intersection between logical mind and emotional mind, and wise mind sort of knows the right things and the values and decisions to make, and to try to tune into that wise mind and give it a listen. The easiest way I can describe wise mind is when you're eating something really, really good and you suddenly get really full, and there's that tiny moment where you're like, I should stop because I'm about to get uncomfortable. But that's such a quiet voice compared to, like, oh my God, this is amazing, I want to keep eating and I'm going to. Like, that's wise mind. And by his mind speaks to me a lot, and I don't listen. But that's just a quick example. Katie O'Dunn at 7:30 p.m. says, I have a student navigating. Nope. Sorry, wrong question. That was this is the question I wanted to ask from her. That was the next question. At 7:32 p.m., can you speak to any tools educators might use to navigate anger rage associated with OCD in the classroom? Susan, I'll throw this to you.
We actually have a website up right now called Anxiety in the Classroom. But I do not know if we have anger and rage on that. So Fran's going to have to pop that up in the chat for us to go through and check if that's got some tools for anger and rage. I think if educators are aware, which is very impressive, that the anger and rage is caused by the OCD, then it's probably working with parents and therapists to figure out what the best tool would be for that specific child. Having a safe space to go to when someone is angry with some clear boundaries about what they're allowed to do in that space, I think is probably the most helpful when you're in a school situation. In her pretty much entire time, my daughter was allowed to leave the classroom and run a little so that she could work through that anxiety. That was by far and away the best tool we had in that kind of classroom environment. So I think there's a lot of tools that educators can use, but probably the timeout is the absolute best form for any type of rage that's happening in the classroom. And I think also it goes back to that question of boundaries and what's allowed to happen in the classroom and what's not. But it depends. Like if a kid's got contamination issues and you've got a kid right next door to them who is aware of it or is aware that, they're coughing on them always makes them angry and gets them in trouble and they think it's funny, then you've got to really be paying attention to that in the classroom. And while, we work towards not accommodating things, sometimes in the short term, the right thing to do is to move that child to a different seat so that they're not being triggered and can actually spend time learning in the classroom while they're developing their skills that would let them sit through that anxiety. So I don't know, maybe Sony would have some better ideas on that.
Dr. Khemlani?
Well, I think if the parents are willing, to share with you what some of the content of the OCD, it's a lot easier for teachers to navigate the situation. So like you said, if it's a contamination thing, that can be resolved in some way, move the child's seat, because it's not always the best time to do the therapy, the exposure therapy. Sometimes you just want the child to be able to focus in the class and get their work done. If it's a child who always has to raise their hand and feels like an urgency to get a need to answer, need to know. So if you as a teacher can figure out if that's what's going on, or they drop their pencil or there's a change in routine. Kids with OCD sometimes struggle with these very quick changes in their day. And if they have difficulty shifting and transitioning, that is something a teacher can maybe navigate with a little signal, hey, in 5 minutes, we're going to switch to math now. So I would say if you can get some more information on that and some guidance from the parents, that's much more helpful to navigate it in the classroom.
We talk
Kyle.
about perfectionism a lot I'm so sorry. We talk about perfectionism a lot on the website too, which can often trigger rage in classrooms. It can be, having to rewrite a letter 1,000 times or reread the same page or whatever, and that can definitely trigger a lot of anger. So I agree with Sony that it's really talking to the parents and trying to figure that out, and then also paying attention to what's happening to that kid.
When you were in school, Kyle, anything speak to you that was effective?
Yeah, I was trying to think back.
Think back 2 years ago?
Yeah, think back. Well, you reached back in time to radios, Ethan. So I had OCD my OCD was very bad in 7th grade, and then there was a bit of relapse in 11th grade, but I went into residential instead of sticking in school for the worst of it. And I was trying to think of what my teachers did that made me feel the best. And I think it was really just compassion and accommodation. And like Susan said, accommodation is kind of tricky to talk about in this context because accommodation is kind of a no-no word in the context of OCD. But I do think to some extent, like this, a classroom isn't the best place to force a kid to do an exposure that they're not ready to do yet. That's going to put the whole classroom in a very awkward and stressful situation. My parents shared with my teachers everything that was going on. And my teachers kind of had a sense of the severity of it and what I could or couldn't do in the classroom. And they just kind of let me do whatever I needed to do to feel comfortable and to make it through the day. And I think that was the best thing they could have done. They gave me as many breaks as I needed, which doesn't sound good in hindsight. But it's what I needed to go to treatment and then focus on treatment after school and get better so that I could be just like a normal functioning kid in school. So I think accommodation is probably the best way to go, and just letting the kid know that you understand that something's going on and that you're going to be there to help them in any way you can.
That's awesome. Thank you, Kyle. Appreciate it. Thank you, Katie. We're just about out of time. So I actually had a pre-submitted question. I always forget them. I have them in a document, so I need to read it before I get yelled at. Can anger, rage be a compulsion? It's a great question. For example, suppose your fear is that someone else is judging you in a social situation. You respond to the fear by getting angry with the other person for judging you. Maybe you even express the anger to that person or others. So the anger in this situation is a secondary emotion. I think it might be a compulsion because there's uncertainty about whether the person is judging, and the anger is an attempt to get certainty. They are judging and they are wrong for doing so. Whether it's a compulsion or not, how do you manage a pattern of trying to avoid anxiety or gain certainty by getting angry instead? Now, I'll throw that out to Sony.
I think if it's if an exposure can be designed around it, do the opposite of whatever the OCD is telling you, right? Let's fight the compulsions. If the compulsion is to get angry, then thank the person for their negative comments towards you instead of being angry at it. I would put it within an ERP framework. That's my simplest answer. Unless there's secondary anger, but if the anger is the compulsion, then we would just do the opposite of what that anger would be.
Susan or Kyle, anything to add?
I would agree.
Okay.
It's a compulsion.
When you first said anger is a compulsion, I was trying to think through it. And then I was like, yeah, no, I could totally see that. Like, let's say if somehow OCD told my daughter that if she stepped on a yellow flower, she would get sick. But if she yelled at the flower, she would not get sick. Right. Okay. So then you can see where all of a sudden I've got a little kid running around screaming at flowers and I don't know why. So yeah, in that case, it would be to do the opposite. It would be to sit down and talk to the flower. It would be to be kind to the flower, pick the flower, give the flower some water. Like there'd be all kinds of different steps we would take instead of being angry at the flower or yelling at the flower, stomping on the flower. And you can substitute whatever you want in for flower. So that's a great question.
It's a great question for sure. And with that, we have 3 minutes left. For those of you whose questions I skipped, I apologize. It's technical difficulties. Also, we have a lot of great questions. You guys were awesome tonight, both panelists and everyone watching. There was so much advocacy happening in the comment thread, which we love to see. And also, we learned a lot in the process. So thank you for that. Also, great resources. If we didn't answer your question or didn't get to it, and we'll give the email address, or Fran can pop it up now, please don't hesitate to contact the IOCDF at info@iocdf.org. If you have a general question about support or treatment or what we're doing, or if you want to donate, that's a great place. But also, if you have a specific question for myself, Sony, Susan, or Kyle, just put in the subject line that this is for them or us, and ask your question, and we'll make sure that we get it to them and get you an answer. So please don't hesitate to do that. Also, Aaron Boone wrote, I just saw it. Aaron Boone wrote, how do you let go of your failures related to OCD and all the opportunities that is stolen from you? I assume this is where ACT comes in. I know we're out of time, but Aaron, I love this question. So I'm going to invite you to please email me and let's talk about that. And anybody else, I love that question. Yes, ACT, but you have to look forward. You can't live in the past. Let me just say this quickly, because I'll get passionate on this, because this is something that I really struggled with. And I don't know where you are, Aaron, in your journey. And maybe Kyle can speak to this too. First of all, I have lots of hope because Kyle's 19 and he's in a place of recovery. And he's just going off to college. I dropped out of college after 3 months because I couldn't find the right help. And it still took me another 12 years to find exposure response prevention therapy. So you bet that by the time I was 31 and got help, I was angry, I was pissed, and I was really upset at everything that I had lost. Whether that was high school, college, sleepaway camp, scared to spend the night out with friends, whatever it is. But at the end of the day, I can come back to two things. One, I wouldn't be who I am without my experiences. As Susan said earlier, you are where you're supposed to be. I wouldn't be part of this community. I wouldn't be an advocate. I wouldn't be in any of the things that I have that are so beautiful in my life, or such amazing blessings and gifts that I truly thought I never had. I've met the love of my life this year. My business is going well. I'm close to my family. My OCD, thank God, is under control. And life, is not perfect, but I wouldn't be in any of these places. Also, one last point is that we all have a perceived notion of what life would have been like if we didn't have OCD, and that too is just a thought. In my mind, if I didn't have OCD, I would have moved out to LA when I was 18. I probably would have been famous by 20 because I was an actor, as you all know, and then like the good life from then on out. Or, reality, I could have been hit by a bus at 19 and none of that would have happened. So we really have this interesting belief that, if we hadn't had this, all these things would have happened. We have no clue how our lives would have turned out. So Aaron, look forward, not back. If you're in a place of recovery, use that as motivation. As Liz McInville always says, turn your pain into your purpose. And look forward. Sorry, I had to go off on that because I like that question a lot. So, Kyle, do you have anything to add to that, man?
You said it better than I could say it.
Okay, I'll take that as a massive compliment. I realize, Sony or Susan, any final thoughts?
No, I think you said it best, Ethan. Honestly,
Just in general, though, in anger, rage.
I think it's a very common thing. I think don't be embarrassed and ashamed to discuss it with your clinician. Work on it. It's a part of OCD. You struggle with a very difficult illness, and it's okay to bring up the anger. That would be my message.
Thank you, Sony.
Bring it on. We'll help you with it as a clinician.
For sure. Susan, final thoughts?
In the meantime, be really nice to yourself.
That's a good final thought. Kyle?
It happens, and with proper treatment, it gets better.
I love that. Okay, so some quick housekeeping. As I said, please don't hesitate to email us. As always, I want to thank our guests, so Sony, Susan, and Kyle, for being here. I want to thank the IOCDF and, of course, our partner behind the scene, Fran, for doing his digital voodoo and making us all look great. Some scheduling stuff for all upcoming virtual streams and content. You can visit the IOCDF.org/peace of mind. That has schedules upon schedules of all the virtual programming we have throughout the week, including, I think we have 5 or 6 virtual conferences coming up starting in the summer, going all the way through the end of the year. So you'll definitely want to check out that website. For a more local view at our forecast, next week at 7 p.m. on Tuesday, we have a Just Ethan at 7 p.m. on Tuesday. I just said that. Just Ethan will be me, Just Ethan, and we'll talk about all things OCD, how our day is going. I like it to be a great conversation. Followed by Wednesday at 12 p.m. There's a lunch and learn with Liz. She's having Dr. Alan Wegg on. They're discussing emetophobia, which is the fear of vomiting. I have that. It sucks. And so definitely tune in if that resonates with you. Finally, if you haven't already, you want to be notified of all the programming the IOCDF is having over the next month. Be sure to subscribe and follow on Facebook and YouTube. And if you didn't know, we are also on Twitch. Boom. I always like this because I like the face. Sometimes the face lands on a panelist and it looks really funny. We didn't get that lucky today. So with all of that in mind, thank you for being here. Really appreciate all the passionate conversation. If you're struggling, I just want to say, if you're struggling, if you're feeling alone, there's groups, there's online groups, there's no CD communities, there's Health Unlocked. Fran, put a link to Health Unlocked, which is the IOCDF's chat forum. You can get a lot of support there. Also check out IOCDF.org. And in the event that we had the number up before because I saw a lot of people. If you're in a dark place, if you are feeling hopeless, if you are feeling, in a sense, suicidal, please don't hesitate to reach out to the hotline that we put up before. There's hope, there's help, there's support. Please don't be ashamed to call. There's no shame in any of that. And thank you, Fran, for putting up that link. So until then, thank you so much for spending your Thursday night with us. As always, have a wonderful evening. Stay safe, stay vigilant, feel the feels. Don't let OCD off the hook. And we'll see you next time. Good night.